Jasmine C. Bolocon from BSN 1A, and today we have a very special interview where we get to hear firsthand from two incredible nurses about their journey, experiences, and insight about the world of nursing. This interview will be conducted through virtually, such as Google Meet in the video they sent, allowing us to connect and learn from them no matter the distance. Joining us today is a wonderful guest who will be sharing their journey in nursing. Please introduce yourself po. I'm Jasmine C. Bolocon po. I'm nursing sa UNC first year. Thank you for being here po today. We have four questions for you po. The goal of this question is to understand the essential qualities and skills needed for a nurse to excel in providing high quality patient care. Are you ready na po? The first question po is why you choose nursing? Why did you choose nursing? In the first question, she stated that at first she was undecided. She wasn't entirely sure what career path she would take. However, her father encouraged her to pursue a course related to medicine. At first, she wasn't completely convinced, but as she went through the studies and started learning more about nursing, she realized how fulfilling this profession is. She saw how nurses play a crucial role in patient care, how they are always at the bedside providing comfort, and how they make a real big difference in people's life. That is when she started developing a deep appreciation for the profession which is nursing. And she knew that she made the right decision. She then said that she graduated in 1994 and been working as a nurse for more than 20 years. However, before she officially started working in the US, she was actually volunteering instead of permanently employed in a hospital. Because of that, when she finally started her job in the US, she found it quite difficult to adjust. The hospital setting was much more fast paced, and she had to quickly adapt to the responsibilities and expectation of being a full-time nurse. Thankfully, a lot of her coworkers were also Filipino, and they really helped her get through those challenges. Their support made a big difference, and over time, she was able to adjust and grow in her role. The second question po is, what are the qualities that a professional nurse must possess? In the second question, she said that there are many qualities that a professional nurse should have, but she believed that two of the most important ones are the ability to make good decisions and strong critical thinking skills. In nursing, she said that she often faces situations where she have to make quick decisions that can impact a patient's health and recovery. There are times that doctors are not immediately available, and in those moments, nurses must rely on their knowledge, experiences, and judgment to act appropriately. She also said that critical thinking is also essential because every patient is different. She can't just follow a textbook approach for every case. Nurses need to assess the situation, analyze symptoms, and think critically about the best course of action. Being able to make sound decisions under pressure is what makes a nurse effective and reliable in the healthcare field. The third question po is, what do you think are the qualities that suits you to this profession? In the third question, she said that one of her strongest qualities that she believes suit her well for nursing is patience. As a nurse, she had to deal with all kinds of people, patients with different personalities, backgrounds, and medical condition. Some patients are cooperative while others may be difficult or non-compliant. especially those suffering from mental health condition or diseases like dementia. She also shared an experience wherein she was a patient with dementia threw a tray on her. Patients with dementia, for example, may not understand what is happening to them and they can become confused, agitated, or even resistant to care. In this situation, having patience is crucial because you need to approach them with understanding and compassion rather than frustration. Aside from patience, she believed that critical thinking is also one of her skills that help her in this profession. She mentioned earlier nursing she mentioned earlier that nursing is not just about following instruction but also assessing situation, identifying problems and making the right decisions. Being able to analyze a patient condition, recognize early warning signs and respond appropriately is a skill that every nurse must have. She always tried her best to stay observant and think critically to provide the best care possible for her patient.
Okay. The fourth question po is, what advice can you share for the upcoming nurses?
For the fourth question, she said that her biggest advice for future nurses is to stay focused on developing strong assessment skills. Nursing is not just about following a doctor's orders, it's about being proactive in patient care. In many countries, especially in the US, nurses are highly independent. They don't just wait for the doctors to tell them what to do, they assist the patient, make observations, and take necessary actions based on their finding. That is why she believed that it is important to sharpen skills in patient assessment. Learn how to observe even the smallest changes in a patient condition, be through in checking vital signs, recognizing symptoms, and understanding what they indicate. The better you are at assessing patients, the more confident and capable you will be in handling different situations. Aside from that, she also said that nurses should be always open in learning or to learning. Nursing is a profession that requires continuous education because medicine is constantly evolving. New treatments, technologies, and procedures are being introduced at all times. So she believed that it is important to stay updated and keep improving skills for the future nurses. She also said that if you are planning to work in another country, she highly recommend gaining experience in a nursing in a hospital in your home country first. Working in a hospital will help you develop the skills and confidence needed to handle real life patients' care. When you started working abroad, the transition will be much easier because you already have hands-on experience. Lastly, don't forget to take care of yourself too. She said that nursing is a demanding job both physically and emotionally. It's easy to get overwhelmed, so make sure to find time to rest, recharge, and take care of your well-being. A healthy nurse is a better nurse, and taking care of yourself allows you to take a better care of your patient.
Thank you so much for sharing your experience and insight. Nursing is truly a calling and we appreciate everything that you do. Yan lang po. Cut na. Thank you po. Thank you.
Good afternoon. Your first question is why you choose nursing. I choose nursing because I have the strong desire to help others and I love providing care and I make a positive impact on people's lives. And there's a lots of job opportunities for nurses in different healthcare settings like clinic, hospitals. Like me, currently I work as a school nurse. My past experience or work are company nurse and community nurse. And lastly, high demand or competitive salary. Number 2 question is, what are the qualities that the professional nurses must possess? A professional nurse must possess a variety of qualities to provide the best care and ensure effective communication with patients and healthcare team. For me, here are some qualities. 1. Compassion and empathy. Nurses must show kindness, understanding, and concern for patients' physical and emotional well-being. Second, strong communication skills. Nurses must be able to communicate effectively with patients, families, and colleagues, providing clear instructions and emotional support. Number 3, critical thinking. Nurses need to assess situations quickly, make informed decisions, and anticipate patients' needs or complications. Number 4, attention to detail. Precision in administering meds and taking vital signs. 5. Patience. We need to remain calm. Number 6. Ethical integrity. Patience confidentiality. These qualities help ensure that nurses can deliver the best care, build trust with patients, and contribute to the overall success of the healthcare teams. Number 4 question. What advices can you share for the upcoming nurses? For me, make sure you are passionate about helping others. Nursing profession is a very challenging, rewarding career choice. Remain positive and helpful. Develop strong communication skills to work effectively with other healthcare professionals. Practice self-care. You need to manage stress. Be adaptable. Be prepared to adapt new situations and challenges. Lastly, don't be afraid to ask questions. It's always better to clarify something if you are unsure or rather than potentially do something wrong. Thank you.
For the two interviewee, thank you so much. In summary, nursing is more than just a profession. It is a calling that requires compassion, dedication, and strong skill set. In this interview, we've gained some valuable insight into what inspired these nurses, what skills they must have, and personal strength they must have to help them, or personal strength they must have in order to succeed. We also heard some great advice for the future nurses who's just starting their journey. That's all. Thank you so much.